When we talk about weight loss at Biltmore Restorative Medicine, I like to emphasize mostly body contouring and fat loss. Let's be honest. Do we really care what we weigh, or do we care how big we are? I like to use the description about how large is a pound of lead and how much space does a half a pound of feathers take up. What would you rather be? Small and tight? Big and fluffy? I mean, at the end of the day, you're trying to lose the extra fat. And we have a lot of options when we try to address this. One of the first and foremost is hormonal balance. At the end of the day, and I'm going to use a female as the example, the typical woman at 50 years of age who may be going through menopause, who's starting to lose her hormone balance, is the patient that working out 2 and 3 times what they used to do, and they're eating correctly, they're watching their calories, they're sleeping well, they're trying to sleep well, and nothing seems to work. That person's hormones are out of balance. Without proper muscle mass, that woman or man is never going to be able to burn fat over the long term. And that's huge. So at least having your body's hormonal balance in check and in play is the first thing that we always look at. And we have other modalities such as Vanquish. People have heard about cool sculpting. Well, Vanquish, in my opinion, is frankly better. And it's a modality that uses radio frequency energy to specifically address fat cells. They heat them up to the point where they die. And these fat cells are gone permanently and forever. And the result is a nice, smooth reduction in fat in the targeted area, particularly the belly or bra strap fat, thighs, love handles. And the ideal candidate is going to be the man or woman who is working out, they are watching their diet, but they have a problem area, an area, let's just say it's a muffin top in a female or love handles in a male, where they can essentially kill themselves with how they restrict their calories and what they do as far as working out, but that one area just won't go away. Women will find themselves losing fat in their buttocks and breasts and in their face before they may lose it in their love handle or their muffin top. That gets frustrating. They're basically going backwards. So Vanquish will target these areas specifically. And what's so nice about it, it's painless. The results are permanent. The results are very smooth. And in FDA studies have been shown to be superior for other modalities such as cool sculpting. That's why we have Vanquish. It's wonderful for our patient population that is working out and is watching what they eat, but just has a stubborn area that they're ready to get rid of. Misotherapy is designed to eliminate or break down fat in specific areas of the body as well. The ideal candidate is the patient who has an area that essentially they're showing it to you by grabbing it. If they can grab a chunk of excessive fat, that fat can be targeted with mesotherapy. Mesotherapy will involve placing a natural acid that attacks just the fat cells, so it won't go against the muscle, and this fat will be broken down and then eliminated by the body. Usually we take multiple treatments. It can be anywhere from 2 to 4 depending on the size of the area, and the time frame can anywhere be from 1 or 2 months to maybe 6 months to get the full effect. There is some swelling afterwards, so when patients ask what the downtime is, the downtime's up to them, meaning people will see swelling if it's in the neck underneath the chin. If it's hidden by clothing, then there's really nothing to worry about. The swelling will be around for 2 or 3 days. There'll be some minor discomfort for maybe 4 or 5 days. Now, the results are worth it. That fat's gone for forever, and so it's become one of our most popular therapies. We are very excited about our use of lipotropic vitamins. Lipo means fat, tropic means burn, and essentially these are fat-burning vitamins. We don't absorb quite a few nutrients as we become adults. Everybody knows that one. And there are certain vitamins, particularly the B vitamins, and then there are some amino acids, methionine, inositol, and choline, that are not very well absorbed. Together, this cocktail of vitamins and amino acids will burn more fat and eliminate this fat. The ideal candidate is anybody who wants to help burn more fat. They are delivered via an injection that we teach patients how to do. It is nothing to do. It's a micro needle. It's painless. It's easy to do, and the results are fantastic. There are patients who report pounds of weight loss or fat loss a month. Everybody's different. There can be some bruising and mild irritation. Most patients find out how to give themselves the shot in a manner that won't happen. There's essentially no downtime, and most of our patients that start doing it and see the results tend to do it for years. It also offers a lot of energy, particularly mental energy. So we have patients who no longer need to lose more fat, but like what it does for their concentration. So it is one of our most popular products. Prescription weight loss medications and fat loss medications have been available for years on the market. There are quite a few now that are FDA approved. And there are quite a few other medications and hormones on the market that have been shown to have remarkable results when it comes to burning excessive fat. Certain ones that big pharma, the big large drug companies use, contain amphetamines or speed as well as antidepressants. And these have been shown to help. But a lot of our patients are not comfortable. They may have to undergo drug testing. They may have an issue with knowing that they're on an antidepressant, and they just don't want to be on these medications. There are other medications that are available by prescription that also help, though, with binges for eating, binges for smoking. These have been proven in the past that help, and we use medicines like this in our office. And then carbohydrate metabolism. Carbohydrates are sugars, and sugars are in everything. And sugars are the biggest culprit for adults when it comes to fat gain and weight gain. And being able to better metabolize our sugars as we become more and more insulin resistant is imperative. And we offer proprietary blends or recipes of compounded medications that address these binges and the carbohydrate difficulties that we face as adults. And so these are some of the physician-led medication methods that we use in our weight loss or fat loss program.